thing we are discussing too is not a single disease condition, but we are discussing different medical conditions under the same heading. So it's more of like a classification, more of like an umbrella having other sub-components under. So this is neonatal surgical emergencies. So which medical conditions will occur in a newborn will require surgery, and a fast surgery is an emergency. It's not a surgery that you have to plan. Okay, you must go into the surgery room immediately as you discover it in newborns. So newborns, of course, you are talking about anybody that has been born and is still within their first 28 days of life. So they actually face unique set of surgical emergencies, most of which are congenital anomalies. Okay, so they usually are born with it. Okay, so for the neonatal surgical emergencies, we'll look at the examples. So the most important part of this video is looking at the examples of disease conditions that will be termed neonatal surgical emergencies. So we can have gastrointestinal emergencies where you're having things like esophageal atresia. I have their pictures here. Okay, with or without tracheoesophageal fistula. It presents with drooling, choking, sinuses. The child is not able to swallow down to the stomach. Then we have intestinal atresia. This one, there's narrowing of the duodenum, there could be narrowing of the jejunal, there could be narrowing of the ileum. So most of the times the child is vomiting and the color of the vomit is green. There's abdominal distension. If you do an x-ray, you see a double bubble sign. Okay, they can also have malrotation with midgut volvulus, where there's sudden bilious vomiting, abdominal pain, and because the small intestine is twisting on itself, it could actually lead to a cut in the blood supply. Okay, the necrotizing enterocolitis usually affect premature infants. There's abdominal distension, there's stooling, and there's blood. Pneumatosis intestinalis, portal venous gas. The Hirschsprung's disease is when there's enterocolitis or obstruction, failure to pass the first two, abdominal distension. Okay, then you can have abdominal wall defects like abnormal gastrosis. Okay, then omphalocele, where the intestines are outside. The diaphragmatic emergencies like congenital diaphragmatic hernia. Okay, which we have actually spoken about almost all of them. They could have emergencies related to the urinary system. That's the urological emergencies. Things like the posterior urethral valves, the prune belly syndrome. Okay. Other critical conditions include congenital lobar emphysema, neonatal tumors like sacrococcygeal teratoma, then anorectal malformations. Okay, so all of these are actually surgical emergencies in newborns. Okay, all of these are surgical emergencies in newborns.